If health matters to you, ask the doc.
Tell me what you see.
Health Matters with Dr. John Darcy.
Now, Katie, before the break, we were talking with Dr. Karen Crawley about mitochondrial disease, which not only affects her little girl, but increasingly she's recognising it affects her son as well.
Yeah, and Karen joins us on the line again now. Karen, what is life like for Cara and your family post-diagnosis of this condition?
Essentially, Cara's had the illness now for 5 years, and in the first 3 years, she had essentially 13 strokes. And
Wow.
so she's a bit like handling your 85-year-old parent with dementia, the type you see them in the nursing home slowly deteriorating, but not much you can really do about it. We actually joke a little bit that she probably needs a geriatrician more than a paediatrician.
Right.
So she really has quite advanced dementia and very much in the routine at home, copes with everything in its place, but short-term memory is not very good.
But how do people like you cope with it? What goes through your mind? Why me? Why me?
Yeah. Yes. Look, we're Christian, but that doesn't stop us being angry at God. I have an argument with him most days.
Yeah.
And our family particularly, I think the biggest support. Our local community has been fabulous. My direct family, my husband particularly, my mother lives around the corner. We moved a bit closer, luckily. So particularly family and very good friends have been fabulous. And it just talking about it, I think airing, for the first 2 years you sort of shut down, but I think airing it out and just letting it blurt out sort of helps get through it too. And I must admit, I find exercise a great release just to get out of the house for an hour here and there and just clear the head a little bit.
And Karen, you mentioned the word community. What do you hope from the community? We obviously want to raise awareness, but what else should people be doing to help out?
Look, we certainly need to raise awareness because it's the second most common serious congenital disorder behind cystic fibrosis, and yet only about 12% of people really know about us or understand us. We're about 6 times more common than motor neurone disease, and yet 87% of people know about motor neurone disease. So we certainly need the awareness up on par. We're not asking to be at the top of the ladder. We're just asking basically for our rightful spot on the ladder, and therefore the community be aware of us, just look out, appreciate that it's there, that it's grossly underdiagnosed and grossly misunderstood.
Yes, they call it the masquerading condition?
It's called the notorious masquerader. It does really shoot itself in its own foot. It likes to look like everything else because no two patients look really identical. And even a whole family with the same genetic defect, each child can present differently. And so it can be very hard to pick. So I guess we just need people to think about it, particularly doctors to think about it, put on the list of differential diagnosis.
Yes.
With the current rates, every 1 in 5,000 have it seriously. That means every second GP has a serious patient, and 1 in 200 carry a gene. So that means each GP out there has about 10 patients carrying a mitochondrial gene defect. So we just need the people, rather than just ignore it, think it's just one of these rare little conditions off to the side. No, it's not.
Dr. Karen Crawley, we're out of time, and I just want to thank you so much for coming on the program and telling us about mitochondrial disease, and also to demonstrate your great love and affection for your family. Thank you so much.
Thanks, Karen.
Thank you.
To learn more about mitochondrial disease or to donate to the cause, visit amdf.org.au.
In a moment, the value of cranberries and all that.